Hey, good optometry morning. So let's explain to you everything you need to know about drops before and after cataract surgery. So when you get cataract surgery, there's going to be 4 main drops that you're going to need. And I'm also going to explain to you what dropless cataract surgery is. But first, let's talk about the 3 main drops that you need and the one other drop that the surgeon might not tell you about. All right, and just a little disclaimer. Every surgeon is going to have their own protocol. So I'm going to go over the main drops that you could use, what they're used for, and the typical dosing and frequency that you're going to be using them. But your surgeon may have a specific regime or protocol that they're going to ask you to do. Whatever your surgeon tells you to do, I would follow those instructions because they have a set system that works well to give them and you the best success. So the first drop that you're going to be prescribed is an antibiotic eye drop. And antibiotics are used to treat and prevent eye infections. And infections after an eye surgery are one of the most feared things that a surgeon has. And the end result can be something called endophthalmitis, which is absolutely catastrophic, and we want to avoid that at all costs. So your doctor is going to definitely prescribe you some antibiotics to use after the cataract surgery, but sometimes they will actually have you start the antibiotic drops 1 to 3 days before you have cataract surgery. Now, typically the surgeon's going to prescribe an antibiotic in the category of a fluoroquinolone. Those are the most advanced and the best antibiotics we have for treating and preventing infections. Now, there's a bunch of different specific drugs that you could use in the category of fluoroquinolones, but many of them will end XOCIN. So if you see that in the name of the drug, it's likely that that is your antibiotic. Now, typically the surgeons are going to have you use this drop probably 3 to 4 times a day. And after the surgery, you're going to use your antibiotics for at least 1 week, but you may use it more if they instruct you to do so. And typically you might want to start treating your blepharitis about a month before you have your surgery. Now, there are other things that you can do to reduce the risk of getting infections after surgery, and the main one is treating your blepharitis. And I've got a whole nother video about blepharitis up here that you can watch, but what you want to do is if you can prevent blepharitis, then you can reduce maybe some of the risk of developing an eye infection after the surgery. And the way you're going to do that is with some type of lid wipe, and specifically you might want to look at treating Demodex blepharitis. Typically, you might want to start treating your blepharitis about a month before you have your surgery, and not only will that help reduce your likelihood of having an infection, but it may actually help some of the dry eye that you might be having before or after the surgery, and that's going to make a better outcome for you as well. Now, the second drop you're going to be prescribed is a steroid drop. Before we do that, I want to just say, hey, thanks so much for getting this far in the video and watching this. And I'd like to ask you a little favor. If vision is important to you and you like hearing topics like this where I make eye care simple, then please do me a favor, hit the subscribe button and the like button down below, because that really tells YouTube that this video is valuable and they should send it out to other people. But now a steroid is going to be used to reduce inflammation after cataract surgery. Now, inflammation is a normal response that our body produces when part of the body is injured. Either it's cut or poked or injured or bruised, you're going to develop inflammation. And inflammation is a way of the body telling you, hey, there's a problem right here. You should probably look into seeing if you need to deal with that and get rid of that. Now, inflammation can also sometimes be an emergency response that the body produces to help heal a tissue. Now, inflammation can be useful in some circumstances in repairing an injury, but in other circumstances, it may not be a good thing. And when you have a controlled injury like surgery, where you are actually in a sterile environment and you're making an intentional incision and you're doing an intentional procedure on the body, then we know that the body's going to heal itself with the aid of the antibiotics and other things. And so the inflammation may not be a good thing. And what the inflammation will do is it may cause a little bit delayed healing. It may cause some pain and discomfort that the patient might have after the surgery. And so when you have cataract surgery, we want to reduce the amount of inflammatory response that the body produces after the cataract surgery, and that's going to be a good thing for you. So one of the main things that used to do this is a steroid, and a steroid will quieten down that inflammation to allow that eye to heal a little bit faster. So the inflammation is what causes some pain. It also causes you to have sensitivity to light. The surgeons will often prescribe a steroid eye drop, for sure for the first week. And so some surgeons will have you stop the steroids completely after the first week, but others might have a taper of the steroid where you reduce the amount of the steroid slowly over the next few weeks after the cataract surgery. And some of the common steroids that you'd use is prednisolone or dexamethasone or loteprednol. But typically you can look at the name of the drop, and if it ends in LONE or SONE or NOL, likely this is probably the steroid that you're going to be using. Now, one of the important things that you need to be aware of if you're on a steroid, steroids reduce your pain and discomfort and some of the inflammation. And so they actually cover up some of the symptoms that something more seriously might be going wrong. In addition to that, steroids can also cause an increased eye pressure in some individuals. And that's why your surgeon's going to recommend you follow up with either your optometrist or the surgeon after the surgery to watch for these things that might be happening if you're on a steroid drop. And now the third drop that you're going to be on is something called an NSAID, and it stands for a non-steroidal anti-inflammatory drop. Now this is another drop that reduces the inflammation in the eye after the surgery, just like a steroid does, but it does it for a different purpose and in a little bit different way. Now, a lot of you have been on an NSAID. That's what Advil is, that's what Motrin is, that's what Aleve is, and these are all designed to reduce pain and inflammation. Now, when we're using them for cataract surgery, one of the main things that the NSAID is going to do, in addition to helping with some of the pain and the inflammation, is reduce the risk of a complication called cystoid macular edema, also referred to as CME, and that's a swelling of the retina at the back of the eye, what happens in a small percentage of people after cataract surgery. Now, I've got a video about CME that you can watch. I'll put it down in the description because that's one of the complications that can happen after cataract surgery. But your surgeon is going to put you on an NSAID definitely after the surgery, usually 3 to 4 times a day for a week. But sometimes they will actually have you start that NSAID prior to surgery, maybe 1 to 3 days before surgery. So you may start it before, you may just start it after, and then you could use it for sure for a week, but sometimes some of the surgeons will have you keep using the NSAID eye drop a little bit longer than a week after the cataract surgery. Now, to know which one's the NSAID eye drop, oftentimes it's going to end with an LAC or an NAC, and if it has that, then that's likely the NSAID eye drop. Okay, so I'm going to get into the fourth eye drop that you should be using, but first, if you've been counting, that's 3 drops that you need to be using up to 4 times a day. That's 12 drops a day. That's a lot of eye drops. You're going to be doing that for at least a week after the cataract surgery. That can be sometimes a lot. Sometimes it's easy to forget what you're doing and it becomes cumbersome. So some of the surgeons will prescribe a combination eye drop. So they can take those 3 medications, the antibiotic, the steroid, and the NSAID eye drop, and they can combine them into one bottle as a combo drop, and then you can just have to take that 3 to 4 times a day as one drop rather than taking each drop separately. So your surgeon may prescribe just one bottle, and if they do, that might be what they're doing. Now, if the surgeon wants something even easier, sometimes they will do what they call dropless cataract surgery. And what dropless cataract surgery means is that you don't have to actually use any eye drops after the cataract surgery. And the way they do that is that during the surgical procedure, they inject into the eye these medications, the antibiotic, the steroid, the NSAID, into the eye so that they're there and they're kind of time released to help reduce that risk of problems after the surgery. And in that way, you don't have to use eye drops after the surgery. So not every surgeon does that, but if they talk about a dropless cataract surgery, or if you referred to as a dropless cataract surgery, that's what they're doing, and the intent is to make it a little bit easier for you after the cataract surgery. Okay, so the fourth drop that you should be using after cataract surgery, but sometimes the surgeons may or may not suggest you using this, is some form of lubricating drop. So a lubricating drop is a really great drop to reduce some of the irritation and discomfort you might be having, as well as treating some of the dryness that is very, very common after cataract surgery. In addition to that, it can also help give you a little bit clearer vision after the surgery because it helps improve the tear film quality. Now, if you're going to use a lubricating drop, there's a lot of different ones out there, but what you want to do is make sure it's a preservative-free lubricating eye drop, and I would definitely recommend that you start with a new bottle. Don't use a previous one, because in case that one's contaminated and you don't want to increase the risk of developing some type of infection. And you can use a lubricating drop as often as you want after the cataract surgery. It's a common symptom that people have a little bit of grittiness or a little scratchy feeling. The lubricating is going to help with that. It might have a little bit of fluctuating and blurred vision. The lubricating drop is going to help with that. You might also have some stinging from the active ingredients and the preservatives in the other prescription drops that you're using, and treating your dry eye can help reduce that burning and stinging that you're experiencing when you're putting those other drops in. Now, the one thing, if you are using a lubricating drops, you want to wait at least 5 minutes prior to or after putting the other drops in. And I would probably recommend putting the lubricating drops after the other drops, but you want to wait at least 5 minutes because you don't want to dilute down those other eye drops to reduce those effectiveness. So the one drop you definitely don't want to use after cataract surgery is any of the anti-redness type of eye drop. It could be tempting because your eye might be a little bit red from the surgery and you might be wanting to clear that up, and you might be tempted to use these anti-redness drops. But these anti-redness drops, they can actually contribute to some of the dryness and cover up some of the symptoms that might happen, indicating a serious problem. So definitely don't use any of the anti-redness drops after your cataract surgery. Now, there's a lot of frequently asked questions about eye drops after cataract surgery, and if you want to hear what those are, you need to watch this video right here. Question number one, do I really have to use these eye drops if my eye is feeling fine? And the answer is absolutely yes. The eye drops of the Steroid, Antibiotic, and NSAID eye drops are all designed to allow you to have a uncomplicated and a quick recovery from your cataract surgery. And if you stop using these drops as prescribed by your doctor, even if your eye is feeling fine, it might compromise the results of your surgery. Question number two, if the drops are stinging when I put them in, should I stop using them? Does that mean that there's a problem with the eye drop? And the answer is no. A lot of the eye drops that you're prescribed after the cataract surgery, they're going to sting when you put them in. And the reason why is because the active ingredients and the preservative in these drops can cause a little bit of irritation. That's definitely not a sign that those eye drops are a problem, and I would recommend you should still be using those drops even if they sting a little bit. Now, there are two ways that you can reduce the stinging that those drops will have. One is you can use a lubricating drop frequently before and after the cataract surgery, but you want to wait at least 5 minutes in between putting the drops in. Or another way is if you refrigerate or keep your prescription eye drops cold, sometimes that cooling effect can reduce the amount of a stinging that they might have. Number three, do my eye drops need to be spaced out by an exact number of hours? So oftentimes your surgeon will say, use your drops 3 or 4 times a day. It doesn't mean that you have to use them exactly by the hour. If they say 3 times a day, what that means, put it in the morning, put it in around lunch, put it in sometime in the evening. 4 times a day, morning, lunch, supper, and before you go to bed. You don't have to watch the clock exactly. Number 4, if I am taking glaucoma eye drops, should I stop those drops before the surgery and after the surgery? And the answer is generally no. If you're on drops to treat your glaucoma, most of the time we're going to have you keep using those drops just like you normally would. You just add all the cataract drops to it, but you definitely want to ask your surgeon specifically about that for you. Question number 5, if I am not sure that I got the drop into my eye, should I put another one in just to be safe? And generally speaking, if you're not sure you got the drop in, put another one in. There's no harm of having extra of any particular drop. And one way that you can help know when you get a drop in is by keeping the drops in the refrigerator. And if the drops are cold, you might feel them a little bit more so you can get a sense that that drop went in or not. Number 6, these eye drops are very expensive. Do I have to use them because I'm worried about the cost of them? The answer is definitely you should be using these eye drops. If you find that the cost of a particular drop is too much for you, then definitely talk to your surgeon. Ask them if there's another cheaper, less expensive drop that they could use instead of the one that they prescribed you. Question number 7, if I forget an eye drop, what should I do? So if you forget to put an eye drop in, what you want to do is just, when you remember, put that drop in and then just get back on your normal course. So let's say it's morning, you forgot to put your drops or one of your drops in and you remember midway through the morning. Just go ahead and put a drop in when you remember. Then at lunch, if you're supposed to put a drop in, put one in at lunch and then put one in at supper. You don't have to start spacing them out at some weird frequency. Just remember, just put the drop in when you remember and get back on your normal course of treatment. Question number 9, does it matter which drop I put in first? Oftentimes you're going to be giving 3 different drops to use, a steroid, antibiotic, and an NSAID eye drop. Does it matter which one goes in first? And it does not. You can put them in any order that you prefer. The only thing we recommend is wait a few minutes in between the drops so you don't dilute or wash out one drop with the other drop. Number 10, how long do I have to use the eye drops after cataract surgery? Definitely you're going to be using the eye drops for at least a week after the cataract surgery, but some of the drops they may have you use them for a few more weeks after that. So your doctor will give you specific instructions on when to stop your drops. Question number 11, can I use lubricating eye drops in the eye that I just had surgery on? And the answer is absolutely yes, and I would highly encourage you to use a preservative-free lubricating drop after the cataract surgery. That's going to help with the healing, it's going to help with your comfort, and it's going to just give you a better result. So definitely use a lubricating drop, but wait about 5 minutes between the drops when you put that lubricating drop in. Question number 12, is there a specific lubricating drop that I should be using? There's a lot of different lubricating drops that are out there. I would definitely avoid any of the drops that say anti-redness or anti-allergy lubricating drops, but use a preservative-free lubricating drop, and that's going to be a great option for you to use. Question number 14, can I use my anti-allergy eye drops after cataract surgery? And the answer is yes, but the steroid drop and the NSAID drop, both of those are anti-inflammatory drops. You're going to be on those after the cataract surgery, and both of those drops are going to treat any of the allergy symptoms that you might be having. So a lot of patients after cataract surgery, if they're on the steroid and the NSAID drop, they're going to find that their allergy symptoms are going to be reduced, and you may not need the anti-allergy drop specifically. And so generally speaking, you can stop the anti-allergy eye drops while you're doing your drops after cataract surgery. Question number 15, should I use my eye drops on the day that I go see the doctor for a post-op visit? And the answer is absolutely yes. When you go to see the doctor for one of your post-op, whether it's a 1 day, 1 week, 1 month, and you're supposed to be using eye drops, definitely use the eye drops before your appointment. Question number 16, if I've had one eye done and I have the other one coming up, can I use the drops from the first eye on the other eye? Generally speaking, you probably can. The only risk of that is if you've contaminated or touched the tip of the bottle or touched it to your eye, there might be a risk of spreading that to the other eye, and you might be safer off using a brand new set of drops. But if it's a short period of time, like a few days or a few weeks between the two eyes, then you could probably use the drops. But likely the drops that you're going to be using on the first eye, you're going to be out of those, and you're going to be starting with a fresh set of drops on the other eye. Question number 17, what do I do with my leftover drops? So if the doctor has recommended you stop using your drops and there's still some left over in the bottle, then you should probably get rid of those because you don't want to keep those on. You can't use those in a year from now because they might become contaminated. So if there's any left in the bottle, the best way to get rid of those is take them to your pharmacy and they can dispose of them in the proper manner. So question number 18, how do I put the eye drops in? If you want to learn how to put eye drops in, then you should be watching this video right here. Step number 1, you want to wash your hands with soap and water to make sure that your hands are clean so you do not contaminate the eye drop that you're using. Step number 2, you want to shake the bottle. Now, some eye drops you don't need to shake, but other ones you do. So it's generally not a bad thing to shake the bottle. There's no harmful effect if you don't need to, but it's always a good thing to get in the habit of shaking the bottle. Step number 3, you're going to open the bottle and take off the cap. And now, if you want to be a fancy movie, you can hold the cap in your other fingers. This is how the doctors often do it. And you're going to point the bottle down. You want to be careful that you don't touch the tip of this either to your eye or to another finger, because you do not want to contaminate that. And if you're putting the bottle down, you don't want to put it down without the cap on so you don't contaminate the bottle. Step number 4, you want to tilt your head way back. So ideally you want to lift your chin way up and look up towards the ceiling to allow you lots of room to put the eye drop in. Now, a lot of people, particularly if you're a little bit older, the muscles in the back of your neck can lose their tension, and as a result, a lot of people that are a little bit older, they actually have trouble lifting their head up. And if that's you, you may not be able to lift it up very high, and it's hard to get the drop in. You may want to lie down on your sofa or your bed to get you in a position that you can put the drops in. Step number 5, you want to pull down the lower lid. Now the lower lid, you don't have to really yank it down. Basically, if you just touch here on your lower lid and press, oftentimes it's going to open up that lower lid and create a little pocket that you can drop that eye drop into. Step number 6, you want to hold the bottle above your eye so it's kind of above that pocket that you just created. So a little technique that you can do, if you're tilting your head back, you're pulling down your lower lid. Then you can rest your hand on this hand and you kind of look up where the tip of the bottle is and look past that, and that often is going to allow that drop to fall right in that pocket. Step number 7, I mentioned this, you want to be careful that you don't touch the tip of this bottle to other fingers or your lids or your lashes, because that might contaminate that bottle. Now if you do accidentally touch the tip to your finger or to your eyelid or your cheek, don't worry about it too much. Don't go to try to clean it off. Don't use soap and water. Don't get something to wipe it off. Just try not to do it and move on. Tip number 8 is squeezing the bottle. Now, a lot of people think that the way to get the drop out is by squeezing the sides of the bottle, which you can do that, but sometimes we don't have the grip strength and it feels like that's not allowing the drop to come out. But a lot of the eye drops is if you actually just press on the back of the bottle, the drop is going to come out quite easily in one drop. So here I'm not pressing on the sides at all. I'm just pressing on the top, and that will often release the eye drop. So it's a little known secret that a lot of eye drops, if you just press on the bottom of the bottle, that's going to release one drop at a time. Not every drop bottle does that, but a lot do. Step number 9, after you have put the drop in, so we've pulled down the lower lid, we squeezed one drop in, you're going to close your eye, and you want to keep your eye closed for about a minute after putting the drop in. That's going to allow that drop to absorb and get to all the places that it needs to be without washing out really, really quickly. And step number 10, after waiting about a minute, you want to take a tissue and just dab off any of the excess drop on your eye. And those are the simple ways to put eye drops in your eyes. And if you want to learn a little bit more about what to expect before cataract surgery, then you should watch this video right here. And with that, have a great optometry day.